Caregiver training. Recognizing and reporting changes in skin condition, including pressure ulcers. What is a pressure ulcer? A pressure ulcer is a localized injury to the skin and or underlying tissue, usually occurring over a bony prominence. It results from sustained pressure that reduces blood flow to the area, causing tissue damage. Key causes include prolonged pressure over bony areas, such as the sacrum, heels, hips, and elbows. Shear forces that stretch and tear blood vessels beneath the skin. Friction from skin rubbing against surfaces, like bedding or clothing. Excess moisture from perspiration or incontinence that weakens the skin. Understanding these causes helps caregiver take preventive action and report to Continental Home Care. Early signs promptly at 718-544-4488, extension 11. Caregiver responsibilities in skin assessment. Early detection of skin changes. Caregivers play a critical role in identifying skin changes early. Spotting redness, discoloration, or texture changes promptly can prevent serious complications like pressure ulcers. Ongoing skin assessments. As part of daily care routines, caregivers should consistently observe and monitor patients' skin during bathing, dressing, and repositioning to track any developing concerns. Collaboration with Continental Home Care staff. Caregivers must report all observed skin changes to Continental Home Care staff without delay at 718-544-4488, extension 11. Accurate reporting ensures timely intervention and coordinated patient care. Normal versus abnormal skin conditions. Normal skin. Even color tone consistent with patient's complexion. Smooth, intact texture without breaks. Warm and dry to the touch. No swelling or hardened areas. Abnormal findings. Redness or discoloration that persists. Swelling, warmth, or coolness in area. Skin breaks, blisters, or open sores. Changes in texture, hardening, or unusual softness. Always compare both sides of the body to identify differences. Risk factors for skin breakdown. Immobility and prolonged pressure. Patients who remain in one position for extended periods face increased risk of tissue damage over bony prominences. Moisture exposure. Sweat, incontinence, and wound drainage keep skin wet, weakening its protective barrier and increasing vulnerability. Friction and shear forces. Skin dragging against surfaces or layers of tissue sliding in opposite directions can damage fragile skin. Poor nutrition and hydration. Inadequate protein, vitamins, and fluid intake impairs the body's ability to maintain and repair skin tissue. Age-related skin changes. Aging skin becomes thinner, less elastic, and more fragile, making elderly patients especially susceptible to breakdown. Early warning signs of skin changes. Non-blanchable redness and temperature changes. Watch for redness that does not fade when pressed, non-blanchable erythema. The affected area may feel noticeably warmer or cooler than surrounding skin, indicating early tissue damage. Discoloration and texture changes. Look for deep red, purple, or maroon discoloration of the skin. Texture changes such as hardening induration or unusual softness, bogginess in the tissue are key early indicators. Pain, tenderness, and itching. Always listen when a patient reports pain, tenderness, or itching at a specific area. These subjective complaints often precede visible skin changes and should be reported immediately. Common pressure ulcer locations. Pressure ulcers most commonly develop over bony prominences, where sustained pressure is greatest. Sacrum, tailbone, most common site. Heels, frequent in bed-ridden patients. Hips, greater trochanter, side lying position. Elbows, resting on hard surfaces. Back of head, occiput, supine patients. Ankles, malleoli, contact between legs. As a caregiver, always inspect these high-risk areas during repositioning and personal care. Early detection at these sites is critical to preventing progression. What and how to report immediately. Report any new skin changes immediately. Any redness, discoloration, swelling, or skin breakdown observed during care must be communicated without delay. Early reporting enables timely intervention and prevents further deterioration. Recognize and report signs of infection promptly. Increased redness, swelling, warmth, pus, or drainage, fever, and any patient complaints of pain, tenderness, or discomfort in the affected area. These symptoms require urgent attention from nursing staff. Prevention strategies for caregivers. Reposition patients at least every 2 hours to relieve sustained pressure on vulnerable areas. Follow a turning schedule and document each repositioning to ensure consistency across care shifts. Keep skin clean and dry at all times. Gently cleanse after incontinence episodes. Apply moisture barriers as directed. And avoid excessive rubbing that can damage fragile skin. Use pillows, foam wedges, and pressure-relieving cushions to offload bony prominences. Ensure proper positioning in bed and wheelchair. Report any issues with support surfaces or equipment to your supervisor immediately. Documentation and communication best practices. Communicate promptly with coordination and nursing staff whenever skin changes are observed. Report findings verbally and in writing without delay. Timely, accurate communication supports better care decisions and helps prevent worsening of skin conditions. Thank you. Contact Continental Home Care at 718-544-4488 for additional questions.